Hello and welcome to COVID Conversations here on WNCU 90.7 FM. We're streaming on YouTube, on Facebook, and on Instagram. I'm your host, Kimberley Cartwright. I'm the News and Public Affairs Director here at WNCU 90.7 FM. And we're using the Zoom platform to talk about how COVID-19 is affecting our world. And I am so lucky today. The guest on the show is Elder Sue Mclaurin, and she's a community health advocate and an elder at Covenant Presbyterian Church in Durham. And today we're going to talk about her work informing underserved populations about getting vaccinated. We'll talk about her service in the Black community. Hello and welcome, Elder Mclaurin.
Well, thank you. Thank you, Ms. Cartwright. And I'm so pleased to be here with you today.
Yes, ma'am. I know you are so busy, so thank you for taking your time out to be with us today. So first of all, let's talk about your role as a health advocate.
Well, I actually began this work in the community after I retired and began as health advocacy in the Durham community. And so I have worked with a number of agencies that have also worked to address health inequity in the African American community. And so my role has been working on a number of projects that related to informing the mostly Black community, underserved communities on health issues that are affecting them and making them aware of how they can become a part of the solution and not just the problem. And so it has, in fact, I can go back to when I was doing some training on the Affordable Care Act, when I went out into the community and also to churches, talking about how people who were uninsured or underinsured, how they could get adequate and accessible health care. And so these are just the things. Plus, we've had a number of projects aimed at health disparities, reducing health disparities in the community, working along with the Community Health Coalition, with North Carolina Central University, with the University of North Carolina Gilliam School of Public Health, and of Global Public Health. I have to put that global, they like to say that now.
Yes.
And so it's not just those groups, but getting them involved in the community, and mostly working in communities that we're trying to advocate for those persons becoming messengers for themselves. And that means teaching them, and I shouldn't say teaching, but making them aware, because a lot of times people know more than what you think they know. And so making sure that they're aware of what's going on around them and how it affects them. And so we're saying conversations, and conversations have to continue to go on. So whenever possible, I try to get involved in those agencies where these policies are actually being, are being driven out of into the community, so that you kind of know what's going on in order to relate that to individual populations.
So can we talk a little bit about what you're actually doing in the community to spread the word about COVID-19?
Yes, that's a good question. Let me just say, first of all, that not everyone responds to getting vaccinated in the same manner. And so when we're speaking about COVID-19, some people are reluctant to become vaccinated because they're waiting for somebody to convince them to become vaccinated. In other words, they're waiting for a message. And many times when you go into a community, you have to know some of the history of what's going on. For example, people talk about they're not involved in things because they or a relative have not been positively involved in the healthcare system. Many African Americans distrust the healthcare system because of the Tuskegee syphilis study. And yet others don't trust the system because they or a loved one have recently been treated in a health clinic and they've been disrespected. And what you do is you actually give them a chance to explain why they feel that way, because you have to have buy-in from them. And that way they feel that you're interested in what they're doing and not necessarily interested in what's going on around them. You want to make sure that they are the ones that you're speaking to. And I'll talk a little more about how you can talk specifically about vaccination a little later. But for example, we at Covenant hosted a COVID-19 clinic, actually 2 clinics for the first and second dosages. And we decided to ask people at that clinic, it's not a research study, just a little question on why did they choose to come to Covenant to receive the vaccine rather than go to the health department. And when we listened to what their responses were, most of them said that they felt the warmth of the Black church. They felt very comfortable coming to the Black church. Others said they lived in or near the community where the Black church was located, so it was convenient for them to come. And some said that they felt safe. And so we look at that when people give those responses back to us and say, those are the kinds of responses that enable us to think about how we should be relating to the community, because those are the things that they value. The other thing that I've noticed is that, especially in our church, many of the people in our church are vaccinated, but a lot of them talk to each other. So I'm sure some of those are influenced by others, just like people in a community are influenced by others, not necessarily me coming into the community, but making sure that others in the community are interacting with each other, because after all, that's where the trust factor comes in, and that goes a long way. And so, you can't guarantee that people will respond because you put out the best message that you can, and you wait for a response from them to say how they feel about doing it. And some people will even tell you that they're going about doing it. So that is how you get messages back to you to say, what have I done? Or sometimes you can ask them, what will make you listen to me? And sometimes it's interesting to hear that.
So that to me was just so smart for you to ask people questions about, how they felt about getting the vaccine or why they came to the church to get the vaccine, to really understand like the heartbeat, I guess, of the community that you're serving. So what are some of the other things that people are telling you about getting vaccinated? I know that a lot of times people won't tell you unless you ask. So what are some of the other things that they're saying?
Well, two of the things that they're saying that come to mind, and I'll say this because I wanted to say first that when you go out and talk to people and you actually share or give them information, you don't need to tell them what you know. You need to tell them what they need to know. And so one of the things that we do is we talk about, first of all, I introduce myself and tell them who I am. And if I know someone in the community, because that helps a lot, because it tells me which direction to go in. And I ask them if they've been vaccinated or if they have not been vaccinated, why, and if others in their community have been vaccinated. Now, we've been around for a while with this virus, which is really sad. And we also now have the Delta variant. And so I move forward with them saying, do you know anybody who has been ill or someone who has died as a result of the virus? If they say yes, then I offer my condolences. And because I've had a family member, someone in my family who has had the vaccine and died as a result of it, and I give them a chance to talk back to me, not to just go on and say, I'm sorry to hear that, but to make sure if there's anything that they want to say. The other thing is, it's important to know who do they trust to give them the vaccine? Where do they go? I tell them from the beginning, if you're vaccinated, that is one of the greatest things you can do, because you're not only saving yourself, you're saving others, because there are people around you who really can't get vaccinated for whatever reason, maybe an illness or some kind of condition that is not favorable for them to be vaccinated. And I also bring up children, because the children are our most innocent. And of course, as you know, we have a vaccine that's coming up, hopefully for them, for the 5 to 11-year-olds. But I let people know that if you're not vaccinated, then you're 4 times more likely to get the virus and 15 times more to die from a disease that is affecting you as a result of the virus. And so that's those, I keep going back to them feeling safe, them feeling that they are not themselves, they're part of a community, so they want their community to be safe. And then that I say to them, the sooner you get the vaccine, the better you are in terms of being safe for yourself and making sure that you are a person who's thinking about the community. I always stress to them the significance of who they are with this total pandemic. They're not just one person, but we're all in this together as a village, so that they know that they can save other lives, not just their lives, but they can save other lives. And so I want to make that point to them. I do say, though, if depends on what group I'm talking to or what individual I'm talking to, is that there are people like me who look like me who are disproportionately getting sick and dying from this. So we want to actually cease that progression of those of us who are getting sick and dying from that, because that disproportionately affects Black and Brown communities. And so I want to make sure that they know that this is another issue that they can actually make a difference.
So, Elder Mclaurin, when you're out and you're talking to people, do you see any kind of like shifts in attitudes? Are you changing any minds with the messages that you're bringing forth?
Good question. And that's hard to measure. Because if you're not around the same community all the time, it's hard to discern what is happening once you leave. Now, you may refer to a zip code and you may know the numbers there and you may read what that is. But when you're talking to people, even though I know numbers are important, they're abstract sometimes to people. And so I usually want to think about a person as an individual, not necessarily as a number. And the best way to do this, if you can, is to keep going back. If you have an opportunity to go back to the community more than once, you have much more of a chance of changing minds, even though I always say the decision is up to them. I never try to make a decision for anybody. The decision is up to the person. But I also know for a fact from not just here in this community, but other places, that if you can find a messenger in that community that can get the word out, that's one of the best ways to change mind. It could be a family member, it could be a friend, it could be someone working there or whatever. Those messages are more messages that might change minds than an individual, but you shouldn't get discouraged or anything. But if you can get the message out in such a way that you're getting someone or several ones in that community to keep getting that message out, that helps a lot with changing minds.
So when you're out there talking to people, what are you hearing about people's attitudes towards COVID? Are they relaxing maybe into the fabric of COVID more so than running out to get like PPE as we did at the beginning of the pandemic? How are people, easing or fitting COVID into their lives, I guess, for lack of a better way to express it?
That is a very good question. And I'll tell you, I really don't think you can relax into the fabric of sickness and dying. I think that's very difficult to relax into the fabric of that. And I say that because COVID-19, in terms of what it is new to us, but it is an extension of long-term health disparities that have existed in the Black community for many, many years. We know that there are disproportionate deaths from the areas of health that Black individuals experience that relate to cardiovascular disease, to cancer, to diabetes. HIV is actually being treated now much better, but at one time that was a high incident of that. And these are things that are still at the top of our list as Black individuals, but those kinds of diseases and disparities that are actually killing the Black people in the Black community. And it's really sad because for a long time, I've been around for a while and I haven't seen an appreciable change in that. Doesn't mean there's not been some changes, but when I think about it, I think of a Langston Hughes poem that he had with The Dream Deferred. And I think of healthcare inequity is sort of like a raisin, in the sun. I also think that it festers like a sore, but health inequity does not go away. While healthcare may have somewhat improved over the years for Black individuals, the masses are getting sick and dying disproportionately because this systemic pervasion of health inequity does not go away. And when it comes to attaining health equity, we really can't say it's because people don't follow instructions and so therefore they're not healthy. You cannot blame the victim when we're talking about health inequity. You have to say, yes, stay healthy, keep healthy, but it takes a healthcare system to help you to be well. And so that way we're seeing that because of the COVID-19 virus, we're really beginning to examine some of the practices that have been going on in the Black community for so long that have not been affirming for the Black population. And I just wanted to mention, for example, if you're reading in the paper today, there are some health practices that algorithms have been developed, like what they call as race norming. And some people may have heard about the National Football League, and they're denying compensations for Black athletes, for those who have suffered brain injury because of multiple concussions over the years. And it found out that they used these numbers to deny them compensation. But also we know that in the medical practice, some doctors have also used this type of practice to determine diagnosis and how to treat people of color. And so these are things in the community that not only are we talking about the incidence of diseases and everything, we need to talk about the causes from the health system itself, because this is more than just individuals. This is something about systemic changes that have to be made. And the COVID-19 is calling that attention because I think the people who are coming along are much more conscious of those things happening than perhaps they were even 2 or 3 years ago.
And we have come to the end of our time. This has been a wonderful, wonderful exploration into what you do and how you are disseminating information to underserved communities. And thank you for being a health advocate. Thank you so much for being my guest today. I do appreciate it.
And you are quite welcome. Thanks for inviting me. And we really are looking forward to those people who are working in those positions that are doing an extraordinary job of working to make sure that this pandemic can end. Thank you.
Yes, ma'am. And we want to thank you, audience. We want to thank you for watching us on YouTube. We want to thank you for being with us on Facebook and Instagram, as well as listening to WNCU 90.7 FM. We want you to like us. We want you to follow us. And most of all, we want you to subscribe to our pages to see more of our archived shows. I'm Kimberley Pierce Cartwright, your host, and thank you again so much for watching.